that say?
Open.
Ta-da. Everyone can see that, right? Mm-hmm. All right. Let's see if this thing works.
USB plug in on that computer. Nah, let's do it.
Okay. I'll give you the nod.
Okay.
Next slide. Casey, no, you're good. You're good now.
Okay.
Just hit the mouse button once.
Oh, okay.
Okay, so everyone can see this, right? Let me first say, this is the first time with me doing this particular talk, so I might stumble on my words, but I'm going to let you know, this is a whole participation. I don't like to lecture, because that's boring. I've been in school for too long, and lecturing is boring, so we're going to do an active participation tonight. If any of you attend regular religious or civil organizations that host lectures and you find this material worthy, just let me know at the end and we'll go from there. But I want to tell you a little bit about me real quick, how I got into this profession. Basically, I was injured at the age of 13, broke my collarbone, it was nasty. I went to the medical doctor and they put me in a sling, gave me some pills, said it'll take 12 weeks, and I was a little bummed, so a gentleman on my hockey team, his dad was a chiropractor, and he had me go to him, and he did some neck films, and he did some a thorough examination. He said, you know, obviously, I know that you have a shoulder injury, but I think there's other things that we can address. So, long story short, I was back playing full contact hockey for 5 weeks, so I knew from an early age the difference of active care versus passive care. So that's what I do. I love what I do, and we will go ahead. Casey, where you go? Actually, you know what? Can you put the mouse right here? I think I can probably just do it. Okay, so we're going to start off. Why do people go to doctors?
They're in pain.
They're in pain?
Sick.
Sick?
We have health care.
We have what?
We have health care.
We have health care? Okay. Dan, anything else? Sick and in pain?
Preventative care.
Preventative care. You go to, so if you woke up in the morning and you were feeling fantastic, you would say, oh, let's go to the medical doctor.
Well, I do.
Okay.
I have scheduled like time that I go in just for
Okay.
preventative care.
Okay. Fair enough. Anyone else? Add or subtract? Yeah. Usually go when you don't feel good. Pretty good. When do people go to doctors?
When they are in pain.
Ah, that's why they go to doctors.
When?
Middle of the night.
What? Okay, literally a time frame, yes. Okay. So why the middle? I'm gonna probe a little bit more. Why the middle of the night?
That's usually when you're feeling bad.
Okay.
You're sleeping, everything kind of.
Okay, that's part of it.
Finally relax and trying to sleep and you can't get to sleep.
Okay. Have you tried anything on your own? Have you tried all your probing a little bit more? Anyone got
Most
it?
people don't. They just go, oh, I can't, and take off and go to the emergency room.
So if you woke up and you had a headache and you couldn't sleep because of headache, would you go to a medical doctor?
No.
Anyone else?
When your own stuff don't work.
Ah! When the lotions, pills, and potions no longer work and they need something more powerful, 9 times out of 10. But yes, the preventative stuff, and sometimes if you're just absolutely not feeling good. But usually, we'll go to a medical doctor when we've tried everything on our own. And so, which leads me to, what do we expect from that doctor's visit? Lori, I'm going to pick on you a little bit. What do you expect? You go to a medical doctor, what do you expect?
Not a lot, usually.
Hey, I didn't say that. I'm not paying you any money to say that.
About 10 minutes with a hurried doctor visit.
Okay, all right. Anyone else would like to add anything? What do you expect when you go to the doctor's visit?
To get pills and be sent on your way.
Okay, but if you could have gotten pills at the over-the-counter pharmacy, what makes a doctor's visit special? Ah, okay, a little bit something different then, right?
If you could do the over-the-counter, that's what you already tried with your headache pills and lotions and whatever
There
those
you go.
over-the-counter. Now you're after something that only a doctor can give you.
Okay, I like it. So to be given something that is unavailable to them over the counter, you pretty much hit that one right on the head. Namely, more powerful drugs to ease their symptoms. Okay, so about these, oh shoot. This is part of my breaking in procedure. Awesome. Are there any harms with these drugs?
Oh yeah, what do they list them? May cause vomiting, diarrhea, blindness, death. They all say all those things now.
That's funny you say that, because I brought in two specific ads in one of my magazines that are in here. The first one's for a drug called Concerta, and Concerta, it has a picture of this poor young boy, and it says all the things that he can't do. It says typical of the school day, he forgets homework, keeps interrupting the teacher, eats lunch alone, and it says time to ask your doctor about Concerta. And he looks like he's, ready for some Concerta, right? If you flip over on the back, it says the following have been reported, not it could have been reported with the use of this drug Concerta: heart-related problems, sudden death in patients who have heart problems or heart defects, stroke and heart attacks in adults, and increased blood pressure. All patients, this is right from that, all patients new or worse behavior and thought problems. Why would I take a drug if I'm just going to make the condition that I'm already having worse? There's a different one, it's called Proseq. That's kind of a clever name. It's an antidepressant. And I've had the highlighted. It says antidepressants increase the risk compared to placebo, which is the fake drug, of suicidal thinking and behavior. So if you have depression, and a side effect is that in addition to being depressed, you're going to have suicidal thoughts. It's just, it was interesting. I'm on Facebook. I don't know if any of you guys do Facebook, but I was actually preparing this talk and I updated my status, and it was interesting because I said, if I had on my website or on my new patient forms some of the, if there were side effects for what I do here, and that you might die, and you might have increase in heart problems, and you might have suicidal thoughts, I don't think there'd be lights on this place. So my question, what kind of program, I know it's kind of silly, we can kind of laugh at it, but it seems as if the picture on the front of the ad, or whatever is the most appealing during the commercial, has superseded the side effects, which is just kind of
That's why they say them fast and hurried and right at the very end.
Yes, it's like the Micro Machine. You guys remember the Micro Machine guy? I don't think he's around anymore.
It's a form of hypnosis. It's subliminally showing you, yes, these are problems, but they show you the wonderful, this is all better now, and your mind says, oh yeah, and then your brain doesn't hear the other because you take in visually, not auditorily, usually, in those commercials and stuff like that. And so if they did it the reverse and showed you someone dying and told you, oh, but it'll make you so much better, it wouldn't work. But it's that reverse hypnosis.
Right, that's why they have
see stuff.
billions of dollars in the research.
Absolutely.
So has anyone heard the cure is worse than the condition? Yes, absolutely. Okay, so the question, this is kind of one question. So if you don't feel good, what we established, if you don't feel good, and everything you've tried on your own has not helped, so you go to the doctor for something more powerful that has potential to make you feel or experience a worse condition, would you be getting healthier as a result of that visit, or sicker?
Sicker. It's not like a temporary fix. So once the
Healthier or
pill is
sicker?
off, well, you're not going to get better, so I guess you're just going to get worse.
But wrap your head around that just for 1 second.
Because you think you're going to be the one that I won't get those side effects.
Right.
I'll get better.
A little craps or a little roulette. Yeah, it's unfortunate. But that's just kind of that just kind of boggles me, right? If I'm going in and we know that the cure is sometimes worse than condition, I could be getting sicker as a result of visiting my doctor. The story gets a little happier. So we know that there's two types of care. There's sick relief and then there's health care. And the sick relief is what most of our culture is familiar with our regular doctor's visits and the insurance and all that stuff. And there's health care, and that's what chiropractic is familiar with. So let's define health, because we're going to start going into it and talking about how to promote health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It's funny because on my other talk that I've done before, I usually ask how someone would define health, and the only comments that I got is that my talks go a little too long, so I'm trying to shorten things up a little bit here. But it's interesting of this definition is that it doesn't say you're healthy when you're not in pain. It doesn't say that if you're out of pain, you're healthy, right? It says regardless of your symptoms, the absence of disease does not mean you're healthy, which is kind of an interesting